welcome everybody to our next episode of Anodyne After Hours, tonight's Regenerative Medicine. And what we're going to be going over tonight is, advance the slide for me.
Sure.
Boom! We're going over regenerative medicine that fits into the Anodyne motto, which is PRP, amniotic, umbilical, and they're going to go over all those technical terms with you. My job tonight is just to introduce a young man who's been with us, who really enjoys throwing needles in people. No, that's not it. He's got $1 million smile, great taste in ties. He is a local legend. John Konopelski. John, why don't you stand up here and stand up. You got this. Ooh, thank you. This is them Bones Creek. So tell me, John, why? What do you enjoy working for Anodyne? Why do you enjoy working for Anodyne? What makes you come to work every day?
Okay, well, that's an easy question to answer. Again, my name is Dr. John Konopelski. I'm a family nurse practitioner, and I've been with Anodyne for a couple of years now. And I've been practicing for over 20 years. And it's interesting, in other places where you practice medicine, the response to pain is either a pill, surgery, or cookie cutter physical therapy. And we don't have any of that here. We don't do narcotics. We try to put off surgery if possible to help you have the quality of life that you want to have. And we have talented people who create a personalized physical therapy program to help you be the best person that you can be physically. So you can enjoy playing with the grandkids or golfing or doing the things that you enjoy doing within reason. You're not going to become 18 all over again, thank God for that. But, we want you to have the quality of life that you want. And Anodyne provides all that here. There are 4 elements here that make a difference to your care. The first element is you have medical, which is my job. Second is you have chiropractics. Dr. Olson, Dr. Shashank, Dr. Kevin, they'll examine you, come up with a good plan to help you reach the goals that you want to have. We have a physical therapist, Dr. Desi, who does an amazing job, and she will help you also obtain the goals that you want. And then the 4th element that's very critical to our care is you. Your input, your feedback is critical to your plan of care. And we are often soliciting your input along the cycle so that you are involved in your plan of care, and then that way we get the outcome that you want. Now, enough about me. I could go on, and people know that I'm kind of shy and don't like to talk about myself. So let me introduce you to one of the great men of Anodyne, a man above all men, whose humility is overwhelming. He brings tears to my eyes, I tell you. This is the master of regenerative therapy, Dr. Ken Olson.
Well, thank you, John. Great to be here. Great to be part of a live broadcast. And, I think it really is important to get the message out about what we do in all aspects of our care. But regenerative medicine is one of my favorite topics, primarily because of the results that we see. We see results in cases that otherwise have kind of stalled out in the traditional management profiles. People get outcomes that they weren't expecting, and most importantly, they get back to doing things that they really love to do. So I am really passionate about regenerative medicine. It fits completely into our natural first approach. And it really complements my background in anatomy and physiology with my chiropractic background. So it's great to be here, and I just want to say it really is great to work with Dr. John. He is an extremely compassionate man. He approaches his care with great attention to detail and really truly prioritizes the patient first. And it's been a real pleasure being able to collaborate with you to bring my knowledge and awareness to regenerative medicine while you get to make the decisions about when and where and how we do it. So that's been a really great complementary approach. So I do want to just add a disclaimer to today's webinar, or not webinar, our live broadcast, which essentially is the information that we're presenting tonight is really for educational purposes only. It's not intended to diagnose or treat or even tell you that this is the right thing for you. We don't know that. We are going to share some awesome success stories with patients that are really near and dear to our Anodyne team, and their outcomes are their outcomes. They're going to speak about what's worked for them. That's not a guarantee of results. It's not a guarantee that regenerative medicine will help you or someone you love. It's their experience. And then lastly, we just remind you that any decision to receive treatment is yours and your medical healthcare decision-making team. So nothing in here is intended to tell you that we're going to help you. But John, you brought back something that's really important to us about the Anodyne model, which is our purpose. And I just want to stress that our purpose really is to help people regain your health, maximize your health, and to help as many people as we can get and stay well from that natural first perspective. What has been your experience in inclusion of regenerative medicine into helping reach these goals? Can you share a little bit about that?
You know, a lot of people, they get frustrated with where they are at physically. They don't feel like there's a lot of options out there for them. You know, we become reliant upon our insurance, our health insurance, and what options are available through that insurance. And we feel kind of trapped, you know, that those are the only things that are available to us. And the regenerative therapy lets you go, you know, outside of that, I don't know, like the shackles of healthcare, you know, like you can think outside the box and get some help in a way that you may not have realized before. And it's made a huge difference. You know, I have seen some amazing things in my time here at Anodyne. And, you know, we have a lot of patients who are doing the things they want to do. They're playing with their grandkids. They're out golfing, probably better than I. And, you know, they're having fun in their lives no matter what the age.
That's not tough.
Ouch. Ouch, yeah. Oh, well. Anyway, you know. So that's okay. That's right. If only there was regenerative therapy for that. But
Yes, it doesn't fix your golf swing. You gotta have one first.
Whoa. Ouch. Ouch. These are my friends, but that's okay. But yeah, many people I think reach the point where they just, you know, they get to the point where they feel, well, this is the best it gets. You know, I'm old. You know, I'm gonna have these aches and pains. You know, I'm just gonna put up with this, and you know, I'll suffer through it. You know, and you know, I'm known for my sayings around here, and one of them is, you know, don't be a martyr. You know, what do all martyrs have in common? They're dead. You know, if something doesn't feel right, if you're not doing the things that you want to do, you know, talk to someone. And the people here at Anodyne are here to help you. If we can't help you, we'll let you know. You know, I have great admiration for Dr. Olson. You know, I've always said that a big difference between him and other providers is he has a soul. You know, he really wants people to get better, you know, and he's willing to do what it takes to make that happen. So it's not a salesman. It's not, you know, he's not trying to, I don't know, force you into something. He just wants you to get better. All right.
Which brings us to why people would tune in. So if you're tuning in or you're going to watch this on a rebroadcast or see it again, generally there's two reasons that people tune in to find out about regenerative medicine. And one is they're just excited to learn. It still is an up-and-coming, vastly growing area of medicine. There's articles almost every day about regenerative medicine and/or stem cell therapy and advances in the use of biologics. So people are excited to learn about that. And if that's the case, I'm glad you're tuned in. And then secondly, people tune in because they're hopeful. They're hopeful that regenerative medicine can help them or someone they love feel or function better. And so if that's you tonight, we hope that we can share why and maybe share some experiences that you might relate to. And then those who are hopeful generally have four considerations. And one is, what really is regenerative medicine? Two, how does it work? Three is, how much is it going to cost? And then, is it right for me? And so tonight we can really only cover the first two of that. We're going to cover what it is and how does it work. The only way to really answer how much is it going to cost or is it the right thing for you is to sit down one-on-one. That's an individual decision that we have to make. So at the end of the broadcast, we're going to give you an opportunity to learn how you might receive a special opportunity to do so. So as we move forward, Dr. John, how would you summarize regenerative medicine? If you had to kind of give one kind of summary idea to it, what would that be?
It's a way of kick-starting your body's own healing process. It's like using the body's natural healing, regenerative abilities to promote the healing, to focus the healing in the areas that you need it. This isn't something that's created in a lab or a strange material. This is like your own body's way of healing itself. And if we incorporate that into your lifestyle or to your health goals, we have positive results. So
yeah, and so to add some clarity, some of these products are processed in a laboratory,
right,
but they're natural occurring biologics, right? And so we believe that the body has an ability to heal and repair itself, right? And so that healing and reparative process works generally very well, unless we have a chronic issue that the body no longer has enough resources to keep up with, or the wear and tear is so great the body can't keep up with the damage, right?
Mm-hmm.
So we talk about regenerative medicine is really this umbrella term. So we created this umbrella because it covers this broad spectrum of opportunities to help the body heal and repair. And it's really any agent that stimulates a healing process so that we can restore, we can replace, we can repair, and we can regenerate the tissue related to damage or ongoing deterioration. Now these can be very simple aspects like nutraceuticals or peptides, and even sometimes diet and exercise, and can change how your body heals and repairs. And then we have three primary sources of regenerative medicine in our office. The first is PRP, which is considered platelet-rich plasma. Now the beauty of PRP is it's very easy to access because it's your own. Through a simple blood draw, we draw up your own blood, we put it through a patented spin process to isolate the growth factors, and then we can draw that up and re-inject it into the body. And that increases the body's own healing potential somewhere between 4 and 6 times. Some research will say maybe a little bit more, but on average, it increases your body's own healing potential. The second product that we use is called amniotic tissue. And amniotic tissue, yes, is the tissue that surrounds baby. Now it's harvested at a full-term cesarean section, so there's no fetal stress, there's no maternal stress. And the unique matrix of this product has a large amount of collagens and cytokines and growth factors and extracellular matrix that your body needs in order to create healing and repair. And then the last product is umbilical cord matrix. So from mom to babies, the umbilical cord, inside there's two veins and an artery, but around that tissue is this gelatinous material that's enriched both with cellular structures and non-cellular matrices that cause a great deal of healing. So we use this combination of products to stimulate the healing and repair. And so this is really a process to identify where there's damage and can we provide an army of healing in there to stimulate soft tissue repair, reduce scar tissue, decrease chronic inflammation, and then promote the healing cycle. So with that, what I'd really like to do is invite one of our special guests. So I'd like to invite Claudia Wallace up. Come on up.
She's one of our favorite people on the whole planet, an amazing young woman.
Yeah, so first of all, Claudia, thank you so much for being with us. You can have a seat. And what we wanted to do with the people at home is just share real life experiences of people who learn about regenerative medicine, maybe through a seminar or a webinar, or maybe a broadcast like this, and then decided, hey, this is of interest, I'd like to find out more. And then Claudia has agreed to share her story with you. So Claudia, first of all, I know you've done several regenerative medicine procedures, and we agreed that you could talk about this. Tell me first, what interested you in regenerative medicine versus some of the other alternative interventions that you've been through?
Well, thanks for having me. I'm glad to share my story. One of the things that I've done is traditional medicine for a whole bunch of years. The surgeries, the pills, the physical therapy, all those kinds of things. And they didn't bring the results that I hoped that I would have. Sometimes they weren't permanent, and then things would go wrong. And it just got to the point where I was just so discouraged and didn't know where to turn. So I looked into some of the regen medicine and decided that it would be worth it to give it a try. Some of that isn't covered by traditional insurance and stuff like that, but sometimes you have to take a chance and just step out and make a decision to try something new. So in doing that, I began small and had a lot of success. I don't know if you want me to tell.
Yeah, you're great.
Okay.
Keep going. Don't stop.
So I've had a knee replacement, and I had that a long time, probably about 15 years ago. And after having the great knee replacement that's supposed to allow you to do everything and didn't, I decided to start with trying to save the other knee. So we started small with that. And as we began it and checked it and as Ken monitored and stuff, we found that I felt better and it felt better. And so then through the last couple of years, we've kept that going. And I'm thrilled. I can get on the floor and play with my dog. I've been able to play with my grandkids and things that I wouldn't be able to do if I had another knee replacement. I also have a lot of body pain, joint pain, inflammation. And we started to do some regen medicine with that and had a lot of success. Used to be every couple months, every couple weeks, my joints would swell up and I would be in bed for a couple days just in a lot of pain and not able to move. As we've done more and more of the regen medicine, the body pain has lessened and lessened. And for me, that's been a big thing. I've been able to walk and do those dog walks and kid walks and things like that. And I honestly don't believe that I would be where I am today without the regen medicine. I have also, blank. Ask me another question.
Yeah, well, first of all, and I don't know if you can see it at home, but I picked up on the emotion in your eyes as you talked about your results. So that's what's so inspiring about what we do is we see the life-changing results. And this has not been a replacement for your other interventions. We've worked very seamlessly and collaboratively with other interventions to help keep your function up. So it wasn't like an either or.
Nope.
It's been an and both for you. And you have very consistently worked over several years, right?
Yes.
We've been at this almost 5 years just in the regenerative med aspect and added rehabilitation and other things.
Yes.
But we've seen your function level actually increase versus decrease, where with age, most of the time, that's what happens, right?
Yes.
So,
One thing I'd like to point out, though, that I think is important for people to know, there's been a lot of places that we've become aware of where they do something similar. But what they do is they give you a shot and they say, okay, love you a lot, see you later, and that's it. We work with patients, we follow up, we continue to build on the progress that we're making. So it's not like a once and done thing. It's not like, I've got my shot and I'm never going to see you again. No, our goal is to do whatever we can to help you move forward. So you have a team of people behind you and we're going to keep working with you. And I think that's a big Anodyne difference, is the fact that you're not just left alone after you get an injection or anything like that.
So I'd like to finish up with saying that the thing that I feel most confident about here is that I am an individual that is cared for by everyone in the practice, no matter what job they have or what they do. They have a personal interest in me. They know me by name. They know what's going on with me and the goals that I have and I would like to achieve. And I feel very confident in them. I have a lot of trust in what they do for me. And I think that's an important thing to have in your medical care, is a team that supports you and helps you to achieve what you would like to achieve in life.
oh my goodness. Thank you so much. And just well said, and we so appreciate you being part of our practice, and we appreciate
Appreciate you
the
guys.
people that you have referred in, and our opportunity to meet that purpose, to help as many people as we can get and stay well from a natural first perspective. So thank you, Claudia.
Thank you, Claudia.
So next, I thought we'd spend a little bit of time on how it works. Like, what is the process of regenerative medicine? And Dr. John touched on it. Like, we are not just a shot and go. We are not just a, hey, let's make a quick intervention and hope the body does well. What we've done over the last 6 years is really looked at the research of what's the healing sequence that's going to happen and where can we best intervene, not only with regenerative medicine, but with traditional interventions that we do in our office, such as chiropractic, physical therapy, other conservative pain management, massage therapy, nutrition, and so on. So we really look at the healing process in regenerative medicine as about a year-long cycle. And as we go through the sequence, in week 1, we're really looking at how do we create the initial change to stimulate healing. And then in weeks 1 to 4, we see the initial growth phase. So this is where we're going to look at doing bracing, immediate medical intervention, and/or monitoring of symptoms. This is where most people are going to start to feel some symptomatic change. And then somewhere between weeks 1 and week 4 is where we're going to start your rehabilitation. So we believe that when an area of injury has occurred, there's generally compensation. So there's weakness in some muscles, there's over tightness in others, there's misalignment. So we've really taken this approach that we really need to create stability, alignment, neuromuscular control, and then strengthen and stabilize it. So that's in this middle section. And then as Claudia mentioned, we started with some small interventions, and then we looked at the overall process of this healing process to go, where else can we intervene and how else can we complement the healing, not only in the knee, but then in other areas of the body. And so in this 3 to 6 month time frame is either the person's doing awesome and now it's time to fly the coop, so to speak, keep doing your homework, your home care, or it's time to go, hey, we've plateaued on some of our progress, or there's other areas of concern that need to be treated. So that's when we consider retreatment. And then at about 6 months, we see that the overall increased healing starts to diminish. So at about a year, we reach that maximum healing sequence. So along this whole line, it's best if you have a team like Dr. John, myself, and our other colleagues to really assess where else we can create and influence improved function.
Right, there's no one size fits all. Every person is unique, and we listen to the patient. If you say this feels funky or this isn't what I was expecting, we address that and we work with you on that. You really are part of a team, and your input is valued here. And I think that makes an impact on the outcome as well.
Yeah, and there's no rigidity in the process, right? It is a plan. Mm-hmm. So the plan is always allowed to change. So with that, I want to bring up a guest who's done some regenerative medicine with us and has also referred in several handfuls of people. Mr. John Bryan is with us tonight. Thank you, John, for being here. Come on up.
Thanks for having me.
So, John, we got to start with you several years ago.
Several?
Right?
20.
So, yeah.
So forgive me if I refer to Dr. Olson as Ken, because I've known Ken, been coming to see Ken for I think this is 2021, so 20 years.
Yeah, so I was 3 at the time.
Yeah. Right, and I was not.
But why you say that, give me just a little background. Why have you continued to work with our office? And you've seen my office grow from a single chiropractic office through this whole model. Right. So maybe share a little bit of your observation with that.
You fixed me. Obviously, if you look at my physique, it's not exactly the greatest, but I don't stretch, and I know that's wrong. I don't work out. My workout is golfing, and we'll get into that in a little bit, and my yard work. And that's what I do to exercise, or I walk. I don't like gyms. I just don't, and I'm bad at stretching, and I shouldn't. I know that. So I hurt myself periodically, and because I overdo it, and so I come in, and Ken and his staff, and They fixed me, and you know, where I learned about the regen, as you call it, is on the golf course. And Ken and I were playing in the Aurora Chamber golf outing. I specifically remember it. We were on the 15th hole at the Aurora Country Club, and I had my little bandit thing on my elbow for my golfer's elbow. No, it was tennis elbow, because golfer's elbow is below. Mine is on top because I have a very strong grip. And Ken said, you know, John, I could fix that. And I asked him.
Well, I don't know that I said I could fix it.
Well,
I might have said I could help.
I could help. Okay, maybe it was I could help, because in my book, and like I said, all results are different, but it is a life change. It was a life-changing experience for me, because you know, he saw the pain that I was in. I have a very strong grip. I play it right to left. And I apparently am a little better golfer than Dr. John is, from what I'm hearing.
I played with both of you, with a little bit of an exaggeration.
So and golf is a main part of my life, as is my gardening, and my gardening and my just anything in the lawn. And so I asked him, you know, well, what is that, you know, compared to because back then, I mean, it wasn't that long ago. I mean, you heard about all the athletes that were going to Mexico. And they were trying to get either stem cells or what have you. And he said, well, it's regenerative, you know, it's different things. I mean, that's for you to explain and not for me. But so I came in for a consultation, and I had had physical therapy before, twice, and it came back. And so I was done with physical therapy and needed something else. But I specifically remember talking to this girl in Aruba, and we were comparing notes of how bad pain is. And I'm gonna stand up because I'm gonna do it. Because this is what I show everybody. If I did this before my procedure, I'd be on the ground in pain. And I'd be, so just imagine walking down the hall and accidentally hitting your elbow. So I came in and I had the procedure on both elbows, because I babied the left one so badly that it occurred in my right one. So I called up Ken and I said, Ken, we got an issue, because now it's in both elbows. And I don't even know all I know is that it was around Halloween, and I know everybody's results are different, but it was life-changing. I could not lift a salt shaker, let alone try and lift a gallon of milk. You know, and you say that, and like, that's crazy. There's no way you can be in that much pain. You have no idea. So I'm a believer. We're working on something else right now in my arthritic ankles. Too much basketball, too many times rolling my ankles, and we're halfway there, and I'm feeling results already. But I'm telling you, the elbow results are, like I said, they're life-changing, because I can, you know, I don't have pain when I golf. I golf 3 times a week. I don't have pain in the yard. I can lift whatever I want. I can saw whenever I want. Unfortunately, I usually have to come to get my back worked on after I do all that. So
Well, I think it's important to draw attention to a couple of things that you said, which one is we played this round of golf sometime early summer,
right.
And so it wasn't like I said this, you ran right in, and it was like
June.
So we played in June, and then it was through the summer we had multiple conversations over and over.
Right.
And so then it was not until the point of frustration had grown so much that you were like, I can't hold the salt shaker, right?
Yep.
Easy for me to say. So it's not uncommon that you hear about this, and then people need to experience or continue to research it, or get to the point where you know, the pain is so great they can't tolerate it anymore.
Right.
So, but you made the decision.
Right, and it was you know, and I know that, you know, Ms. Wallace Claudia brought up the idea of cost and whatnot, and I'm not going to go into the cost, but if it was 100 times more than it cost me, I'd do it again. I mean, it's
Another procedure.
that life-changing. You want more?
This is that part where I say you went the soul thing now. Yeah.
But I mean, I'm thrilled, and I know a lot of people. I was lucky enough to spend the winter in Florida, and I saw a lot of people with, it's either some sort of brace on their elbow because of their pain. And I told them, obviously they don't live around here, but I told them about, the process that I had and that it worked for me. And I tell them it might not work for you, but it worked for me. And I wouldn't be surprised, and I bet I told at least 10 people. And I wouldn't be surprised if at least half of them have looked into it. Because you could see these, they're men that were basically older than I am. Even though I'm old and falling apart, as Ken likes to say, well, he's been around a long time. He comes in, we patch him up, and then he sends me on my way because I don't stretch. But I do come in for the physical therapy and Dr. Desi, she's amazing.
Phenomenal.
It's amazing. So anyway, I'm really happy with it. I don't know, what else can I say?
And to cycle back on that, your experience was you had physical therapy prior to doing this, and it wasn't successful. And in part, some of these therapies need the right sequence of healing in order to maximize their effect, right? So regenerative medicine can springboard the healing process, and then it makes the therapeutic approach of physical therapy or chiropractic or other interventions more successful. So
Exactly.
I think the last thing I would say, or just ask you, is somebody sitting at home watching this going, I don't know if it's right for me. Sounds too fake, or sounds like too unbelievably true. Like, what would you tell that person as far as the process that you took to learn more in maybe from our first conversation to why you decided to do it?
Well, I researched, obviously. My wife, Erin, likes to call my iPad my dirty little mistress because it's with me always, but I am a king of research. And so I researched it, and I looked, and I came in, and we sat down, and we had a long consultation. And, nowadays, if you can get, 15 minutes from your primary care doctor, you're pretty happy when you walk out. I think you and I discussed it for well over half an hour, and you said, we are going to look at it, we are going to x-ray it, we are going to make sure it's right for you, and if it's not repairable, then you need to go see your medical doctor and see what they can do as far as whatever that is, what they do for golf and tennis elbow. I know my mom had it many times ago, but it was a long consultation, a lot of research, and then I made the decision, I can't take it anymore, and that's why I did it. But you got to do your own research. Listen, and then you go forward with what the recommendations are.
Yeah, and that's what we'll offer to you at home. We always offer the opportunity to sit down one-on-one so we can hear your story, so we can find out what's bothering you, and as John said, make the decision, is regenerative medicine fit? Does it fit in the course of treatment that might be right for you? We know there's lots of options out there. So our goal is to offer the opportunity for you to be informed, to complement the research that you're going to do on your own. And we're going to spend a thorough amount enough time with you to understand your problem and, more importantly, what your motivating factors are. Your motivating factors are like, what do you want to accomplish? Golf was really important to you. Walking without an assistive device was yours. Walking the dog, playing with the grandkids, travel, right? Those are all important things to them. Playing tennis or exercising or traveling away from the grandkids might be the most important thing for you. But that's what we're going to do. And so I just want to end with, can you imagine? Can you imagine at home if tomorrow you start the path to feeling better? Can you imagine what it would be like to not wake up in pain? Can you imagine what it would be like to be able to return to the activities that you love? Can you imagine if you finally are on the course of treatment that helps you reach your goals? That's what we want to extend as an opportunity for you. Think about how happy you'll feel, or how happy you'll be when you feel better. Think about how happy your family will be when you are feeling and functioning better. So I would like to end with this. One, I want to thank our guests, and I really appreciate you sharing sincerely what your experience is, and it's truly our honor and our privilege to be able to work with people like you to get the results that you desire. And for those of you who are at home, I want you to direct message us. So go into your direct messenger, send us a message, include your email. And what we're going to do is, if you direct message us right now, we're going to send you a gift. And the first part of that gift is the opportunity to come in at no cost and sit down one-on-one for a consultation so we can hear your story. So we can hear where your injuries are, where your problems are, what you've already tried, and start the conversation, as John said, in a very thorough way to find out if regenerative medicine or our other suite of services can help you feel and function better. And then inside that gift, there's going to be an additional promotion for you that if you decide to move forward with care, you'll get a little discount for tuning in today and direct messaging us. So closing comments, John?
Again, I'd like to reiterate, and I think John talked about this too when he was down in Florida. You know, there are so many people who are just accepting this is as good as it gets. You know, and if you're at that point where you feel like you don't have any other options, now you do. You know, so take the opportunity to reach out and see if there's something that we can do for you. You know, if we can't help you, we're going to be honest with you. You know, our goal is for you to have the life that you want within reason. You know, there's nothing that's going to improve my golf game. But, you know, if you can walk your dog, or if you can golf, or you can garden, or do the things that you enjoy doing within reason, you know, we want to make sure that we can do our part to make that happen.
Cool. In closing, thanks for tuning in tonight. Again, thank you to our very special guests. I also want to thank our awesome staff at Anodyne. I don't think I validate them or acknowledge them enough. Nate behind the camera now, who introduced us, has done an awesome job of putting these things together, so I sincerely appreciate you. And thanks for tuning in tonight, and I hope we have the opportunity to help you feel and function better soon.
Take care. Thank you.